Okay, time being 6 o'clock, I'd like to call a Board of Health meeting to order. All members present, excepting Christine Pfeiffer, who is absent. So, first item on our agenda for tonight is everybody's favorite COVID-19 update. So, I'll pass it over to Marty for that.
All right. Thank you, sir. So I was able to update the dashboard on our website before I left at 1600 today to the 144 active cases in Abington. That brings our total case count to 1,086. We have approximately 121 people in quarantine. That number may slightly skewed lower because we're not 100% sure of the cases that we sent to the CTC yesterday and today, how many additional home quarantines there could be. So that number may be a little lower than it's actually. Statewide, as of 5 o'clock today, they added another 3,800 and some change cases, bringing the state's number up to 375,455. The test positivity rate on Thursday was 11%. I wouldn't be surprised if that actually went down this week and then back up tremendously next week based on the unavailability of testing over the Christmas holiday and the New Year's holiday. So I expect those numbers to be a little skewed, and I'm curious to figure out what direction they're skewed in. My intuition says they'll be skewed a little lower on Thursday and then significantly higher next week on Thursday when they come back out. We're continuing to update the website as much as possible, and we sent out a constant contact today. We had our close contact frequently asked questions, and I apologize for having to send it out twice, but there's a lot of numbers on there. There's a lot of information, so we had to make an update, and thank you to that person that pointed it out that it may have been an error. So we sent a new one out. Please check that. That's also on the website. Contains a lot of detailed information about how long your quarantine could be. And I will remind everyone that the quarantine of a household contact of a positive case is significantly longer than just a quarantine of a positive case at like work. Household contact can spend a lot of time in quarantine, especially if there is a subsequent positive in the house. And this, of course, means that they can't isolate. So if you have a 17-year-old in a fully furnished basement, they can go in there and completely isolate, then their quarantine is only isn't going to be that long. But if they can't, especially if it's a school-aged kid in the elementary level, you could be in quarantine for quite some time. So I appreciate everyone's patience with that. And with school starting this week, I'm begging people, please stay home if you're sick or if you have any COVID-like symptoms. And I know that is a broad umbrella to live under, but any COVID symptom, please stay home. If you are pending a test result, please stay home. If you think you had an exposure, please stay home until you can get tested. That way we don't have to completely clear out an entire grade level. And maybe we can keep schools open a bit longer. Yeah, I think that's all I got unless there are any other COVID update questions. I'm sure I will remember something after a few seconds go by.
And we are anticipating an uptick based on the holiday weekend.
Yeah, I think we might be already starting to see it. But one of the problems is because all of the testing sites were closed during the Christmas holiday and during New Year's, the uptick in positive cases probably won't happen until the middle or the end of this week. And then that number will continue to climb. I know the governor spoke about this today. He alluded to that we could be either not as bad as the Thanksgiving break, but I think some of those numbers aren't exactly accurate right now because of the lack of testing over the holidays and the lag time from someone getting a test and its resultant. So, I mean, hopefully we won't see that massive uptick that we saw after the Thanksgiving holiday, but honestly, it is still too early to tell. So please wear your mask, wash your hands, keep your distance, stay home if you're sick, stay home if you're pending the test result. I know it's a broken record, but that's how we get out of this. And with the vaccine coming out, which is the next item, I won't jump ahead, there is light at the tunnel.
Cool. Did anybody have any questions on our COVID update? discussion. I just wanted to mention before we moved on, because we've been asked through Facebook a few times, just to make people aware, we are sharing all the information that we are comfortable and able to share. We're a small town, so there's privacy concerns. Obviously, there's information that some people might want that we are not at liberty to give. So if you see it, we're giving you what we have.
I'm certainly not trying to withhold information. Knowledge is power in this. If you have any questions, call the office, and we'll do our best to answer them. Just, it can be a very delicate situation for other people, and we don't know the long-term effects of this. I know that some people have caught COVID and they bounce back in 5 days, or they've had no symptoms whatsoever after that. And I know people who've caught COVID and then had previous illnesses exacerbated by that, or unexplained fatigue, unexplained rashes. Like this affects people differently. So we are not trying to hide any information. I will be as open as I possibly can, especially if you get me on the phone. I will tell you everything you know, or everything I know that is medically and scientifically accurate.
Excellent. Thank you.
Marty, any word from Superintendent Schaefer on how, because I know school went back today. Any word on that?
Specifically, like how many kids, or I know they had about 120 absences today, but I don't know. So I talked to Superintendent Schaefer and Dr. Michelle like every day. That's a line of communication that we keep open. So if there's a significant uptick, and we'll try to do our best to get ahead of it. And I have to talk to them every day because I want to make sure that they have all of the information that they have to make an appropriate decision on whether or not it is safe to have children in the building. It is. So here it is, our test positivity rate, our number of cases, all that. So we talked a couple times today. And Lindsay, my public health nurse, the town's public health nurse, and currently Sarah LaPointe, who's kind of taking the lead over at, she works at the high school, with the help of all the other nurses in the school system, are communicating nonstop throughout the day. So the procedure and the policy that we've kind of come up with, and I think it's been good, and I think it's one of the reasons we can safely open schools right now, or at least as safe as possible, is because we have taken a very aggressive stance on communications, quarantine, and classroom safety. And we can use those two nurses talking to each other anytime an address comes across. Is that a COVID? Is that address have a student in the building? You know, we can cross-reference everything to try our best. And there's just every family needs to make the decision that's right for them, but we're going to do our best to stay as accurate and up to date with all that information. So we talk about cases, numbers, at least a time or two a day. I hope that answered your question.
Yes, it did. Absolutely. Because I know a lot of residents were wondering about, how school was going to be opening today and stuff like that. So I'm sure people really appreciate the feedback. Thank you, Marty.
We're doing our best. Okay, next item on our agenda is COVID vaccine discussion and Q&A. So what our plan for that is. So again, Marty, all you.
So we are working with Dr. Dan Muse out of the Brockton Hospital. He is our supervising physician for Lindsay in our office, and the paramedics in the fire department and the first responders. So it is his license under which we do medical stuff in our town, right? That's an oversimplification, but you kind of get the point. He is our point of contact for vaccine ordering to be able to distribute to our first responders. So right now, as of today, through our office, through Dr. Muse, we ordered and received approval for some vaccine doses to be given out to first responders. The expected delivery date is sometime between now and the 11th. I'm not 100% sure because we haven't been given that. And I believe they'll be going to Brockton Hospital, and then we will get them from there. But because Abington has the billing system and the scheduling system already built into our infrastructure from our work with the flu clinics, we have kind of a leg up. So we'll be able to start giving our first responders shots as soon as humanly possible to do so. All we're really waiting for is the juice that goes in the needles, because we have everything else. So the plan is to start next week. Hopefully, this is all things going as planned, blue sky day, as they say in the business, as early as next Wednesday. I know there are a lot of questions about this vaccine, and I encourage everyone to go on the CDC's website and read the emergency use authorization. It doesn't have a vaccine information sheet that you would traditionally get from, if you get the flu shot, you get that piece of paper that has all of the flu shot information on it. Well, this, you get an emergency use authorization because it is not gone through the entirety of the process yet. So go read that, read the contraindications, read the suspected side effects, read that. And currently the only thing that we're there, well, it's not the only thing, but one of the concerns is if you've had a previous anaphylactics or a severe allergic reaction, it might be best if you get it from your physician. Or if you're comfortable, then your wait time is after we give you the inoculation, you have to wait 15 minutes to go back to your normal day. The wait time would be increased to 30 minutes. And of course, if you have any other questions, please call the office specific to the vaccine. And I know it says Q&A here for our plan, and I would love to field some questions if you have them.
I have a question, Marty.
You.
Are our first responders required to get the vaccine?
Currently, no one is required to get it.
Okay. I was just wondering.
No healthcare worker, no first responder, no person is being required to get it.
We had a question through our Facebook page. When and if vaccines become available for elderly and shut-in, is there going to be some sort of announcement made?
Yeah, we will set up a scheduling mechanism for that when it comes available. I can't give you an accurate time frame. Anything I would have would be pure speculation. But as we're not going to sit on any vaccine. If we're given it, we're going to get it. Or if we get it, we're going to give it. And there may be points during the rollout that if a first responder is not available and I'm sitting on one shot, we can kind of go down the priority list to the next person and try to find someone to give that to. So if I have vaccine and we're following the rules and the procedures to give it, we're not going to sit on it. It's going to go out as soon as we get it. So when we schedule to give our elderly population or more of our shut-ins, we'll schedule it then. And I asked Suzanne DeJustburg, the Council on Aging Director, if we can use the Senior Center again, and she was gracious enough to say yes to that. So I think because it's an environment they're familiar with and it has the large waiting room that they could wait in for after the shots, the Senior Center would be the best delivery site for our elderly population. Any other questions about that? All right.
Well, that was easy.
If you have any, or you think anybody, everybody knows my phone number, you can give me a call. I think everybody knows my cell phone number at this point.
Next item on our agenda is flu shots, discussion and extension. So, Marty.
Is this me again? Okay. All right. All right. The flu shot mandate for school-age children. I remember we had a long talk about this, and we decided that we were going to offer it to our residents at Abington so they can get it through us and not just their primary care or their pediatric physicians. That deadline was the 31st. It has since been extended until February 13th. So with that in mind, we're going to schedule 2 more flu clinics we would like to focus on our kids, but if you still haven't got the flu shot and you're an adult, let us know. Both of those, Angela, help me out here if I get this wrong, okay, are the January 12th, which is a Tuesday, from 1 to 4 at the Council on Aging at the Senior Center, and January 15th from 9, which is a Friday, from 9 in the morning to noon. We'll be having another flu clinic there to try to help our residents get their shots. And I know that there's been some concern about the mandate, and I will reiterate, mandate or not, we will offer the flu shot to all of our residents because we think it is a medically important thing to get. So that's January 12th, 1 to 4, and January 15th, 9 to 12. And you can expect an update and a scheduling mechanism, or if we just do it as walk-in, email shortly.
Okay. Both those dates at the Senior Center?
What's that? I'm sorry?
Both dates at the senior center?
Both dates at the senior center, yes. Thank you, Suzanne DeJustburg. We appreciate you working with us on that. And we also ordered next year's, well, it's this year's, I'm sorry. It is the fall. We ordered our fall vaccination number today. So we will have shots for the coming flu season as well.
Awesome.
So please get your shots, and we will give you the paperwork to take to the school nurses so that they don't have to ask you for it when you come there. And it is as quick and painless as we can possibly make it.
Well, thank you.
All right.
Any questions from Marty on flu shots? All right. Next item on our agenda is compost site update. So now it's Angela's turn to talk.
All right. Can you hear me okay?
Gotcha.
Okay. So at the compost site, I've been doing is getting all the containers emptied, that being electronics, scrap metal, mattresses, and propane. New England Recycle came to the site last week to grind and rotate the leaf piles, so soil will be available to residents come the next season, which will be good. We haven't had that in a few years. And we are in the process of cleaning out items that are not accepted but have been somehow kind of accumulating over time. So we'll be getting a dumpster delivered on Wednesday to clear everything out. And then Christmas tree grinding, that'll be done after next week's curbside collection. That's going to be Saturday the 9th. So once we get those at the compost site, we'll get those grinded. Waiting to hear back from Elliott Tree to get on their schedule. And then to be expected for next season, prior to opening, I'd like to meet with the volunteers to discuss what items are and are not accepted. And I'd like to give them the resources on where residents can bring items that aren't accepted if they bring them not knowing. And our vendor for electronic recycling, the pricing has gone up, so an increase in pricing is to be expected. We are in the process of calculating that now, so I don't know how much it'll increase, but that's just for the electronics. And just I am pursuing all options for grants to expand our compost site recycling options. And that is it for updates. But if any residents are interested in volunteering, please reach out to us.
Awesome. Thank you. Strong work up there. I know when I met you down there, I saw that pile of stuff that's not supposed to be there. It's pretty
Yeah. Yeah. Growing pretty quick, so it'll be good to get rid of that.
Any questions for Angela? All right. Well, thank you for the update.
Sure. Thank you.
And the last item on our agenda is waste disposal budget discussion. And I think we got several people.
Sit. So I'll
All right.
Scott, if you don't mind,
What's that?
I'll start real quick.
Sure.
I sent everybody the that Excel spreadsheet that had the costs broken down for our total fees paid, or the bill basically from Republic as far back as January 2019, and up to the latest one we got, which was in November. As you can expect, with the pandemic and a lot more people home, we got an increase in tonnage, which led to an increase in the costs that we're paying. And I projected as best as I possibly could on the bottom left what I anticipate to be the costs from December to June of this year. What I did was I averaged the previous months, and I took the standard deviation for that, and I added half of that, which I think is a fairly accurate way to do it. I know there's some Excel and some statistics, people who would probably do it a little bit better, but I wanted to keep it simplistic. And since December and January are traditionally our heaviest months, and we end up paying the most, I felt that was the safest way because it's on the higher end of her projection. So all of that said, the projected bill for the end of the year is about in almost 1.3 million. and which is almost what we budgeted. But next year, well, it's actually this year, the 2021 to 2022 contract is up. And I think that's a good time to turn over to Scott. Scott, if you want me to add anything, please let me know.
No, that's excellent. I appreciate it. So yeah, the contract is up, and obviously we're going to have to carry a pretty big number going forward. We have between now and June to sort of make up our minds on what we're going to do as far as, are we going to renew it for public or go out and do something else? So there's a lot of options available. There's what I would like to do and is take a couple of members of your board, a couple of members of our finance committee, and a couple of members of the selectmen, and just put a small working group together to look at all the different options that are available. Let's look at what other towns are doing, and let's see if there's a way to maximize the use of the compost site, reduce what we're picking up on the sides. If we want to, look at options on how it's funded, if we take it out of the levy and do it separate, but not that we, at the end of the day, we may not change anything. I think we have to change something. I think we have to, do something to do our waste management a little bit better, just to get these numbers down. But, this is our opportunity. We really just have between now and the end of June to come up with, if we want to change something, come up with a plan. And like I said, there's a lot of different ways to do it. I've reached out to some of the other cities and towns in their area just to ask them what is it that they're doing, and it's different everywhere. Some towns are doing the pay as you throw. Some towns are doing, just what we're doing. They're doing basic curbside, but they don't offer yard waste pickup. You have to bring that to a location, and there's a fee for that, an annual fee. There's some towns that are just saying, you know what, you're on your own. Go ahead and hire whoever you want. There's plenty of companies out there, and we don't care. So, like I said, it may very well be that this group comes up at the end of all of this and says, whatever we're doing is probably better than anything else. Let's put it out to bid and just get a number. Or on the other hand, maybe we'll find something better. But I don't, again, I don't want to, it'll be Zoom meetings. We won't meet, any more than we actually have to. But I think it's just important that while we have this opportunity to get the right people involved, and let's just kick some ideas around.
That's a good idea. Subcommittees. Everybody loves subcommittees, right?
Well, I want to call it a working group.
Working group.
We're still subject to open meeting law and all the rules, but it's just, again, I don't expect it. It could be, we could have 2 meetings into this and just realize that it's a non-starter, and we're better off just, reaching out to the companies that are out there and say, look, we give us a new price on what we've been doing. But I think at the very least, let's just look at what else is available, look at exactly what we're doing. I think Angela could probably give us an idea of what's actually going on down at the compost area there, that maybe, some ideas that we could do better. And so it could be quick. Either way, we're done by the end of June because we have to make our decision by then.
Cool. Anybody have any questions or discussions on that? I'm fairly certain, speaking for myself and the members of the board, you probably get a couple of people off this board, no problem.
Okay.
Sit on a committee.
So I'm meeting Wednesday night. We have our finance committee meeting, and I'll bring it up with them the following Monday, a week from tonight. I'll be meeting with the selectmen. They're aware that, I'm going to be asking them. So I would think by, Tuesday, Wednesday, I'll send something back out to everybody. And, if you guys want to decide in between now and then who's interested in doing it, if you have somebody missing and you want to volunteer them, go right ahead.
Christina's ears are burning.
Well,
and obviously, I'll be working with Angela and Marty on this, and Sue's going to be involved over in sort of help us with some of the numbers on all this too. But like I said, it's just, here's an opportunity. It's in front of us. We know we have a problem. Let's try and address it.
Cool.
All right.
Wonderful. Thank you, Scott.
Thank you. And hopefully it won't be so hard to get a couple of you.
I'm usually good with volunteering.
Good.
That's why we're
Writing
here.
your name down.
Yep. There we go.
I just wanted to circle back to our COVID discussion. Apparently, we had some questions on Facebook. Somebody was asking, and Aaron, correct me if I don't have the context right here, about teachers and the vaccine. If there's a plan for, I don't know, if they're considered for frontline or.
They are not considered first responders. No.
Okay.
Um,
So they'd probably be somewhere in that phase 2.
I'd have to check the phases, but I know they're not. They're definitely not phase 1, and I'm pretty sure they're not phase 2.
Okay. We'll look into it.
And on the same discussion, we also had a question asking what vaccine we're receiving, if you know.
Moderna.
Moderna.
So no crazy.
Thank you, Marty.
No crazy refrigeration, right?
No, and we already had. That's just with just as I get, we'll call it luck, as luck would have it. Lindsay and I did a lot of the legwork to be able to keep all the vaccine in our office. So we have a vaccine refrigerator with the digital data logger and all of that good stuff, which is the thing that the state requires of us to have to be able to store and safely handle vaccine. So we had all of the infrastructure ahead of time. And the Moderna vaccine allows us to keep it in normal refrigeration we can keep it frozen at -15 to -25, or we can keep it in our refrigerator for up to 30 days after it's been thawed. So the Moderna just gives us a lot more, we'll call it wiggle room. So that's the Pfizer vaccine just doesn't have because of its ultra cold requirements.
And if I'm not mistaken, the Moderna is 28 days in between shots.
Yeah, 28 days later. If you and there's a day or two on the other end of the 28 days. So when we schedule we schedule firefighter A for his shot, we're already going to book him his next appointment for his second shot 28 days later. So we'll be doing them in the middle of the week so they don't fall on a weekend. And then everyone will get the little Moderna vaccine card. I don't know, in my military days, we called it the PHS 735, which was the little yellow card that you wrote all your shots down in. So basically we're regressing to that specifically for the COVID vaccine.
All right. And that was it for questions, Aaron? Okay. All right. Unless anybody has any other questions, I will take a motion to adjourn.
I'll make a motion to adjourn, Chris.
All right.
I'll second that.
Okay. We have a second. All in favor of adjourning, say aye.
Aye.
Uh,
Marty, Angela, Scott, thank you all for joining us tonight.
Thank you all.
And stay safe, everyone.
You too. Happy New Year.
you too.
Bye.
All right.